session for February 10th, 2026 at 7:30 a.m. in conference room 2C. Ms. McDonald, would you please call the roll?
Mayor Slamka,
Here.
Mr. Richmond, Ms. Zipsey,
Here.
Ms. Baggett,
Here.
Dr. Zollett, Ms. Lawley,
Here.
Mr. Bunnell,
Here.
Ms. Miller.
Is there a motion to excuse Mr. Richmond and Ms. Miller?
So moved.
Is there a second?
I said,
Has it been properly moved and seconded? Is there any discussion? Hearing none, we'll proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey,
yes.
Ms. Baggett,
Yes.
Dr. Zollett, Ms. Lawley,
Yes.
Mr. Bunnell.
Yes.
Yes, is have it, the motion passes. Thank you. At this point, do we have any citizen comments at this point? We'll just wait for the presentation. All right. Okay, we'll continue then on the agenda. The approval of the meeting minutes from January of 2026. Is there a motion to approve the minutes?
So moved.
Is there a second?
Yes.
Has it been properly moved and seconded? Is there any discussion about the minutes as they are written? Check through for a second. Okay. Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey,
Yes.
Ms. Baggett,
Yes.
Dr. Zollett,
Yes.
Ms. Lawley,
Yes.
Mr. Bunnell.
Yes.
Yes, it's happened, the motion passes. Next on our agenda this morning is to receive and file our financial report for January of 2026. Is there a motion to receive and file the financial report?
So moved.
Okay, is there a second?
Second.
It has been properly moved and seconded. Is there any discussion about the financial report this morning? Questions or comments?
We are caught up, and this is January's report, so we should be back to filing and receiving the current months, the past month's financial report, so.
All right, thank you. All right, any more questions or comments or discussion? Right, hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey,
Yes.
Ms. Baggett,
Yes.
Dr. Zollett,
Yes.
Ms. Lawley,
Yes.
Mr. Bunnell.
Yes.
Yes, let's have it, and the motion passes. Next on the agenda this morning is our education, our air quality of Southwest Ohio air quality presentation. Thank you so much. Good morning.
Hi, you ready for me to?
Oh, yes, please,
Okay.
yes.
Just come up here?
Yes.
Okay.
And go ahead and introduce yourself and let people know where you're coming from.
Yeah, my name is Carrie Caslin. I'm with Southwest Ohio Air Quality Agency, and we're a local air agency that serves 5 counties in Southwest Ohio for Ohio EPA. So we do all kinds of air quality work down here. For Middletown, you guys sit at the intersection of lots of industry and transportation and residents. So we spend a lot of time actually in Middletown responding to air quality issues. And I'm here to talk about kind of a report of what we're seeing in Middletown in 2025. So I wasn't able to get my presentation up on the screen, I apologize, but you have it in front of you, and you kind of see on the first slide an overview of our agency. So we're doing permit work when we come to Middletown, where a company is applying for a new air quality permit. Our office is reviewing that. We do inspections and compliance work, we answer complaints, and then we do air quality monitoring, which I'll talk more about in my presentation. And why does air quality matter? Does anybody want to guess how many breaths we take a day as humans on average, according to AI?
According to AI.
That's pretty cool.
8,000.
Okay, anybody else? Higher, lower?
Higher.
Higher.
Yeah.
I'll say 1 million.
A million, between
It's-
7, more than 7.
According to AI, it's 20,000 breaths a day humans take on average. So all of those breaths that we take, our air quality is affected, especially with children, older adults, and maybe kids with asthma. I mean, those are the susceptible populations that the reason why we have air quality rules and regulations to protect all of us humans that are taking all those breaths a day. Poor air quality obviously causes asthma attacks, heart problems, early death, respiratory issues. So that's the reason for my job is to take care of making sure that companies are in compliance with regulations. The next slide is sources in Middletown I'm gonna talk about. Of course, industrial facilities. The two big industrial facilities that I'll talk about today are Cleveland Cliffs and Middletown Coke. They are heavy industry and have been here for a long time now, and they are big sources of the work we do. We're probably coming to Middletown once a week to do something related to air quality inspections or answering complaints. And then also, we're definitely here once a week because we're also taking care of our ambient air monitoring sites. So probably here at least twice a week, our agency is to do one of those things. So other sources in Middletown, other than you think of industry, how we all got here today is driving our cars and mobile sources and trains and airplanes. Construction, we sometimes will get complaints about construction and fugitive dust related to construction activities. Building being demolished, that's a reason you can reach out to our agency, both regulating the fugitive dust coming from the demolition or asbestos. So that's a reason to reach out to our agency if you guys get contacted for either of those reasons. Also, regional transport, pollutants coming from other sources come into Middletown, so that's, we often have seen, because all of the monitoring in Middletown, we have seen effects from power plants down on the river that were coal burning. We could sometimes see SO2, sulfur dioxide, spikes when we had more coal burning along the river. So we definitely, you'll see regional transportation issues when those large sources of air pollution are blowing the wind this way. And then open burning. We do have open burning complaints in Middletown, so if you hear about those things, we're the agency to call and we'll respond. We work directly with your fire department to respond to complaints, and sometimes we make the field response, sometimes the fire department does, and we can use their records or their fire run reports just like we are there ourselves. So that's the evidence we use often to respond to complaints. And sometimes we do go out on complaints and see a resident is open burning, and we try to educate them on what the open burning rules in Ohio, what they are. The pollutants that we're concerned about, there's a slide that has the pollutants, and those are the pollutants I'll talk a little bit about today. I guess the pollutants of concern I'll talk about most, but for the pollutants you see on that slide, there's health-based standards at the national level that are called the National Ambient Air Quality Standards. And the two that I'll talk about today mostly are particulate matter and sulfur dioxide, because those are the pollutants that are in Middletown from your heavy industry here. Next slide is the Middletown monitoring sites. We actually have 5 monitoring sites in Middletown. That's a lot of monitoring. Probably, I was thinking on the way here, it's probably the most monitors in a city in all of Ohio. I need to check that fact, but there's a lot of monitoring. Some of it was historically put there because of AK Steel. Some was added when Middletown Coke Corporation was started up operations. I think that's been about 15 years ago now. So we had monitors added just for, they're called industrial monitors. So monitors that were added just for that site. So we have those 5 monitoring sites that look at, each site looks at different pollutants. So, and then I was gonna talk about monitoring trends for SO2 first. Again, for SO2, you can see the line at the top is the National Ambient Air Quality Standards. So all of the monitors in Middletown, which are the 4 that look at SO2 below it, we are in compliance for the SO2 3-year average, essentially. You do see a spike that happened at Yankee, and that's because we think that occurred because of emissions from Middletown Coke Corporation. So that made the spike occur and made the average go up over the 3-year time period. But you do see, taking out that spike, we have seen an overall downward trend, and a lot of that is due to less coal burning. And as we burn less coal in Ohio, our SO2 numbers have continued to decrease. So we overall are seeing, in all pollutants, we see downward trends, and this is an example of one of them. AK Steel and Middletown Coke Corporation both have emissions of SO2 though, so we sometimes see localized spikes for both particulate matter and SO2. The next slide was monitoring temps for PM 2.5. So PM 2.5 is 2.5 microns and smaller. It's the very small particles that are regulated because they get into the small, and you guys probably know more than I do, but get into the small parts of the lung and can create health effects for those very small particles that are smaller than a human hair. We have a 24-hour average, and you can see from the chart all of the monitoring in Middletown shows us in compliance with the 24-hour average. For the annual average, you can see that we are above the 9 micrograms per meters cubed for PM 2.5 for the annual average. US EPA recently asked the courts to vacate the 9 micrograms and move it up to 12 micrograms, what it used to be. So that's kind of a political issue right now based on the US EPA and who is, it's kind of been flip-flopping based on Republicans or Democrats in office at the national level. So the EPA did ask the courts to vacate that lower level of 9 micrograms. So if that goes through, it will go back up to 12, and we will probably stay in attainment. If not, then it's possible that we may go into non-attainment in the future for PM 2.5. So that's kind of something we're watching closely, and we'll continue to make sure we're collecting good data, and it'll be something that is interesting, and you know how politics is. So, and then PM 2.5 or PM 10 is a larger particulate that we track. Some of the spikes you see on this chart for PM 10 is, I think I was here last year or the year before and talked about the wildfire smoke that we saw in 2023, and some of the spikes you see in that affected our 3-year average for PM 10. And so that's the reason for those spikes. And there's not really much we can do about that, but we are in compliance though for PM 10 because you can see the line, the National Ambient Air Quality Standard. We are still below it, but unfortunately we have environmental, natural disasters that are probably affecting air quality going forward that we have to be aware of and try to let people know what they can do when things like that happen. And I will talk about that in a minute. The compliance summaries, because we're talking so much about Cliffs and Middletown Coke, Cliffs, we have only sent during 2025 one notice of violation, and that was in the area, if everyone is aware, Middletown Coke Corporation makes the Coke, and they conveyor it over to Cleveland Cliffs. And one of the conveyor lines, we did a visible emissions check, and they were not in compliance with that visible emissions determination. So they had to do some work to increase the control device, the spray bars, I believe they have for that, and they made that fix. We went back and re-inspected it, and it was in compliance. So that's an example of an issue that we identified through an inspection and followed up with a notice of violation, and then they came into compliance by fixing it. So that was the issue that came up for AK Steel or Cliffs, Cleveland Cliffs in 2025. For Middletown Coke Corporation. We had a bigger issue with that facility. They had failed a stack test, so periodically, companies have to hire a company to measure the emissions coming out of the stack to see if they're in compliance with the levels that they're required to be in their permit. And their main stack, they did a stack test, and they failed that stack test, and they were actually out of compliance for a year because they had to wait until they were in their shutdown mode. When you're running a Coke oven, you can't just turn them on and off. They have to stay running all the time. They have to stay heated or they will not stay functional. So they had to wait until a maintenance period to fix the issue. And the compliance plan that they submitted to us was to repair poppet valves. And they did that, and they recently retested and passed. So now we have had several notices of violation surrounding that. So now we're working with Ohio EPA on enforcement orders that we're trying to negotiate with the company to prevent reoccurrence of this in the future. So that's kind of an ongoing issue that we're working on with the Coke oven over there. Next slide is Middletown complaints, and you can see a lot of the complaints that we get in Middletown are odors. And, but we can respond to, like I said, open burning, fugitive dust, particulate fallout. An example of a complaint I'm going to today, Quaker called in a complaint yesterday and said they're getting particulate fallout. And I'm gonna go over there after I leave here and look at what they are complaining of, but they are saying they are receiving more particulate on their property, so we will interview them, investigate it, possibly take a sample if we're able to, take photos of it, and then we will try to determine the source of the particulate fallout and likely do an inspection at one of the facilities that we think is the source of the particulate. So that's an example of what, some work we're doing today in Middletown to respond to an air quality complaint. Other types of complaints, in case you guys get them, if you get a CFC complaint about like Freon or an asbestos complaint, you can forward those all to us. And I think the last slide here gives our main number for you to give to residents if you have complaints. Every year I've been giving you guys the number of complaints that we get about cliffs. You can see there was an increase this year in Cleveland Cliffs complaints. Last year we had, we've been pretty steady actually. Other than 2020, we had one complainant call in 150 complaints. But since then, that complainant still calls, but not daily, weekly type thing. But she does call on a regular basis, but just not near as much.
What do you do? I mean, what's the end game of this?
I mean,
do they get fined?
yeah,
what's going on here?
Yeah, we continue to investigate the complaints and we try to identify.
But what's the,
Yeah.
when you've identified the complaints.
Yeah.
Well,
we have to prove that the complaint is being caused by a certain company.
what,
Yeah.
so what do you, this is ridiculous.
Yeah.
You have all this, and you must have 150 things here.
Yes.
What happened to them? Are they fined, or are
Well,
they?
like I talked about Middletown Coke,
Yeah.
they have been issued a penalty and we're negotiating.
What's the penalty?
The penalty was $170,000 initially.
Well, what's it now?
We're still negotiating with the company. We're working on, are there action items they can take that will reduce the odors or particulate coming from their operations, so.
But how long you been negotiating?
For a couple months, probably 3 months. It's kind of like if you go to court
Ridiculous.
with somebody, then you have attorneys on both sides, each working their part of the case. So we have an attorney with Ohio EPA, and You know, we lay out our facts, they lay out
So
their facts.
far, nothing's happened to anybody.
Well, we've had, yeah, over the years, we've had different enforcement cases. Right now, we're moving to a new office, and I'm throwing away a lot of old samples from 20 years ago. And I do, like, I've been at the agency 27 years, and I know you're frustrated, but there have been
Well,
improvements.
I didn't even know this happened, or, you know, I didn't know anything about it, but when I saw this in the
Yeah.
packet, I said, well, you've got a bazillion complaints here
Yeah.
from the same two companies.
Yep,
And I understand that they're big companies in Middletown, but
Yeah.
come on, I mean, if, that's like dealing with your kids, if you tell your kids something and you don't follow it up,
yeah.
they'll keep doing the same thing, and obviously, they're doing the same thing, so, I mean, that's a lot of time and effort and money and everything going into this, and nothing's happening.
Yeah, and I mean, it is a frustration, it's a frustration for our agency, and that's why we put so many resources into coming to Middletown on a regular basis and doing inspections, and I did make a slide of the things that we're doing. If you go to the next slide, Middletown Coke, look at the complaints for Middletown Coke, and this is Monroe and Middletown, not just Middletown. So your list does not include all the odor complaints, because I don't think it would have captured that. But we have 170 complaints about Middletown Coke Corporation, so we're spending lots of time digging in and trying to figure out what is different, because last year we had 21 complaints. And so that is a huge concern for us, and why we're spending so many resources.
My question is,
Yeah.
does odor equate to
Problem.
pollutants?
Yeah, I mean, so.
I mean, when you can smell it, does it mean that something is obviously?
Sometimes, I
in the-
mean, sometimes there could be something wrong, like one of the things we are gonna be looking at is, Middletown Coke, I know, has spent, I think, $70 million making upgrades to their ovens, because they are so many years old, and they had identified some problems with the ovens. Now, if the facility is 15 years old, and, 5 years ago, I only had 7 complaints, we are trying to identify what is different and what has changed. We know some of the time in Monroe, when winds are from the north, today I think we have south winds. And so the odors are blowing up towards Middletown, but when we are getting south winds, or north winds that blow towards Monroe, I know there's been a social media presence that people are putting out, like, here's how to call in complaints, which we wanna hear, but we also know that when people are sharing on social media, that we'll get a spike in complaints. Like, on a particular weekend, we might get 50 complaints related to odors from Middletown Coke Corporation. So, and they push during the night normally, so odor complaints usually start at 9 o'clock when inspectors are not in the office. So we, last week, did like a nighttime inspection. And we've had people starting to come up on the weekends, because we have to be able to trace it back to the source. I can't just say, I've got 150 complaints and I know it's you. There's 2 big corporations right here in Middletown that can point at each other, and I have to be able to determine which facility those odors are coming from. So it is complex, and the industries are hard to inspect, a lot of federal regulations and difficult permits, so we're working hard to try to do everything we can to respond to citizen complaints. So the next slide says, what can we do?
Did
Which
you
is,
notice that, I think you said that,
Yeah.
a decrease in their compliance or with the feds with decreasing what they have to do? You follow me? I mean,
regulations,
the regulations,
Well-
have they cut the regulations under this new,
administration,
yes?
they, I think President Trump did give them an extension on complying with new rules coming out. So those were delayed, and those would have affected, I think, both Cleveland Cliffs and Sun Coke. It was called a MACT rule. It's a federal rule, and there were new requirements that were coming out. and President, I think I'm pretty sure that both companies asked for an extension because they felt the regulations were too stringent. And my understanding is, I'm not involved in that day to day, but my understanding is
Yes.
that rule has not come out yet because of extensions given. But what can we do as an agency? Obviously, responding to citizen complaints, concerns, communicating to the public. We're adding inspections and site visits. And then when we identify violations, we'll do enforcement of air quality rules if non-compliance is found. We also are here weekly doing air monitoring and then working on data analysis from the 5 monitoring sites in Middletown. I mean, the good thing is, even though we are getting a lot of complaints, a lot of our air quality data, those limits are protective, are supposed to be protective of public health. All the experts in air quality have set national ambient air quality standards for the United States, and as you can see, for the 2 pollutants of concern, SO2 and PM, we are in compliance with those national ambient air quality standards. That's the good news. The bad news is, we still have a lot of work to do with figuring out what's new and different that's happened over the last year and see if we can make some improvements for the residents in Middletown. And then what can residents do? They can check daily air quality forecasts, and that's kind of one thing I mentioned was if there is an event like a wildfire, there is air quality alert information on our website or on, they're carried on all kinds of websites now. You can look at daily air quality forecasting and know what the air quality is. So if you have a child with asthma or a susceptible population, elderly, you can look and see, oh, air quality is good today. It's green, meaning it's good. It could be yellow, caution. So those are all available for you to check if you have someone susceptible in your family. You want to limit outdoor activities if there are poor air quality days. Some of the poor air quality days might be because of ozone. It might be if there's wildfire smoke. Those are days, you might want to stay inside and not be outside exercising if there is a poor air quality day. And then you want to report air quality concerns or odors to our office. Obviously, there's always, as an individual, you can choose to make consumer purchases based on transportation or what you buy that is protective. Try to combine trips and not idle when you are driving. As a city of Middletown, you might want to look into like hybrid vehicles or electric vehicles as those become more available in the future, to try to be a leader in that electric vehicle, because those are going to be the next big air quality decreases are with our transportation sector. And then reduce wood burning. This time of year, people do wood burning. We do know that people are affected by wood burning. Even if it's allowed by rules in Ohio, it can aggravate asthma, both indoor air quality and outdoor air quality if someone is breathing. The wood smoke, although it's allowed, it's definitely higher levels of particulate matter inside your home and outside if you're around a wood smoke fire. And household chemicals, that's something that US EPA has on their website, is try to buy, because your indoor air quality is more polluted typically than the outdoor air quality. So be mindful of how you cook and what you buy and use inside your home, because that affects everything in those 20,000 breaths a day. It's a big part of your day is inside.
I was gonna check my air quality on the inside, and Carla said, you may not wanna know, and I said that.
Yeah.
Cause that means you have to do something about it, so.
Some
that's
people
hard.
have been buying these devices
No, you
called
don't.
purple air monitors,
Uh-huh.
and you can put them inside or outside, but it will tell you, a lot of people bought them for wildfire smoke,
Okay.
But they are monitors that you can buy for $200, and it will tell you particulate levels. It's not like our $50,000
Right.
monitor to say, oh, we know what the air quality is for sure, but it is a device, they call them sensors. And those low-cost devices, and then you connect it to Wi-Fi, you can see across the United States where the different levels are for all the purple air monitors. It's a cool device, initially used for wildfire smoke, to help communities know which way the smoke was traveling. But sensors are gonna become a bigger part of our lives. There may be a day that your iPhone has like, oh,
Sensor.
air quality's bad here, it's all, that's all changing. So how to register a complaint, obviously if you guys get calls, share our number. A lot of complaints are coming in on our website now at southwestohioair.org. Those again are the types of complaints that we'll respond to. And I guess the one I didn't talk about was anti-tampering. If someone is tampering with a vehicle that you get a call about, we do have people certified to respond to anti-tampering complaints where we will look for a defeat device. I don't know if you remember when Volkswagen had the big lawsuit with US EPA and they had to, pay a big, $100 million or penalty because they cheated on their emissions. That was like maybe 5 years ago. So anyways, we have people certified to investigate anti-tampering. So if that's a situation where you ever need help or have a question, we also have 2 inspectors certified for asbestos. So if you have an issue that you need our help on, we have them certified to be able to take samples for asbestos and inspect properties for asbestos concerns. So feel free to reach out on either of those issues.
All right, thank you. Do we have any questions or comments? Yes.
You had mentioned earlier coming in and doing testing if there's a demolition or
Yeah.
fire. Do you automatically come in and do testing, or does the city need to contact you if there's a big demo or fire?
We typically, if you are demoing a property as the city, you are required to hire someone to do the testing.
Okay.
And then the demo contractor is required to notify us of the demo. They notify actually Ohio EPA, and we're all in the same database, and then we might come out and inspect it. If you see something that you think you want us to check on, or that's really dusty, you can call in a complaint. So it happens, or if there's like, if there's a situation in Middletown, like, this is what the contractor's telling us, and you want some insider, advice, you can always reach out. And Holly Reeder is our main asbestos inspector and very knowledgeable, so she can come out. She also tries to look at building. She periodically will reach out to jurisdictions. I don't know if Middletown has a place on your website to know when buildings are being demolished, but often we work with building departments to try to also check to make sure that people are notifying us, so that we want to ensure that the asbestos is removed prior to the demolition. There are sometimes emergency demolitions, that there are other circumstances. If there's a fire in a house, those situations might be handled differently, or you can't sample it because of safety concerns, but always reach out, because but we actually have 3 people certified now. So we have people that can come up and respond to complaints.
Any other questions or comments? I have so many questions, but.
Go ahead, give me 3.
Okay, let's see, when you mentioned that indoor air quality is typically more polluted than outside, I think that's one of the things our residents could do, right? So I think it's useful to talk about that a little bit.
Yes.
What are some of the ways that people can, what are some of the things that are harming indoor air quality, and then what are many of the things that people can do to improve indoor air quality?
Yeah, so a couple things. We get a lot of calls about mold. And we can't go into residential homes, and you probably get them every week like we do. But what we refer people to about mold is US EPA has a website that talks about mold and how to deal with it. So that's usually what we give to people when they call about their residential mold. I also have a pamphlet that talks about know your rights as a tenant, and I often will give out that to residents if they are not the owner of the house, but they are a renter. I will give them that one-page pamphlet along with the US EPA websites on mold so that they can work through the situation themselves. And I try to equate it to, if your furnace breaks down, you know, you're responsible. Same as if you have mold in your basement or in your bathroom, government agency is not gonna come out and do anything about that. You have to hire a contractor and figure out why the water is there and what's causing the mold. And so that's probably the most calls we get are about residential mold. After that, air quality, I mean, it's the things you cook in your home. Like, make sure that you're well ventilated, your vent is working when you're cooking. I mean, that's a large source of air pollution. If you're cooking a steak on a flat top and, you know, the cooking smells, that's all air pollution in your home. If you have burning candles, I mean, those are often volatile organic compounds, VOCs. So I tell all my friends, like, don't burn candles, that's bad for your air quality. Having an indoor fire, a gas is better than wood fire, but I mean, those are things that.
Electric better?
Yeah, better than wood, but if you have a child that has bad asthma and you have a big wood stove or wood fire, that could be aggravating the asthma. The next thing I think of is VOCs in our carpet, our paint. You can buy now, I think, low or no VOC paint when you're painting your home. I saw something in the news last week that said, hey, it's the middle of winter, nobody's opened your house. Open your doors for 10 minutes and let your house air out, even though it's super cold. So one day when it was got up to, like today, be 50, like open your house up, let it air out a little.
Oh, my old house has so many leaks in it.
Oh, that's good.
But
But houses are getting
I'm
more
I'm
airtight.
stuffing paper all in my cracks.
Yeah,
I got plenty of air.
Yeah,
but yeah, so.
Yeah, but that, I heard that, like, open up
That's
your
true,
house,
that's
let it
true.
air out, you know, spring cleaning, and then cleaning, the cleaning products you use. You know, there's, I think US EPA also has on their website, and, like, the more environmentally friendly cleaning products. I mean, there are choices, and a lot of the things I've been reading is use vinegar and water, and Dawn soap, and don't go with the harsh chemicals. Those are all VOCs, you know, that can affect human health. And you're seeing that a lot of lawsuits or news around people using weed killer and links to cancer or health effects. And I think, you know, if I were to go back, I probably wouldn't have used those products when I was younger. But I mean, I bought them and used them. Now I just pull the weeds. You know, so those are some, I guess,
That's
tips
good.
and tricks. Radon would be the other one. If you have not tested radon in your house, and you know, that's something, if you sell a house, you have to test. But I had to install a radon mitigation system, so the link between radon, I think it's 3 picocuries per liter is the action level. And if you're above that, you could be having a higher risk to lung cancer. So a radon test, there's companies that will come in, test for 24, 48 hours and know whether you are above or below that action level.
And Ohio Department of Health gives out free radon tests.
Oh.
Yeah,
For
and
everyone.
I'm sure you guys deal with lead, like lead remediation and lead. I don't know much about that, but I know health departments have, you know, lead concerns, and especially with small children in older homes.
Yeah. So that's something that I've heard as well, about, not about radon, but about opening up your house.
Yeah,
Even just like 5 minutes every day, even in the coldest months, open
Yeah.
the windows, 5 minutes, and then close them.
yeah.
I guess it's also something that people do in the old countries as well.
Yeah.
Like back many, many centuries, where people have been doing this for a long time. Okay, so with the cleaning products, I wonder if that's something that we could even have,
I'll try to find that
education about.
website and send it to you.
Also, those pamphlets sound amazing.
Yeah, the
Okay.
The
pamphlets.
Know Your Rights. 'Cause
Okay.
We get a lot of calls about stuff like that.
Yeah, I'll send that, let me write.
Well, and I can send you an email.
Yeah, I
I'll send you
mean,
an email.
Know Your Rights is a great one when residents call. And I just try to talk them through, because, I mean, I think that a lot of, your agency and ours, I mean, there's not a government agency that will respond to mold, and we just try to educate people as much as possible, so. It's difficult, because, I mean, sometimes we get one call a week on it.
Are, sometimes we see on television or other places advertisements for, air filters.
Yeah.
Are those useful? Are you able to recommend any certain kinds or types to look for?
Yeah, I mean, I have one in my bedroom because my husband has bed allergies.
Mhm.
So I just looked up, I just tried to look up what, on AI, like what are the best air filters
Are they
out there.
helpful?
I don't know. I think you have to make sure you change the filter
Hmm.
and not cause a situation, but, I mean, I think, yeah, I'm not an expert on that by any means, but, I have one in my bedroom. And so I hope that that helps. Pollen and mold are bigger particles, especially pollen. I mean, some of them are big particles, and so I think especially for those bigger particles, it definitely would be something. In your furnace filter, there's all kinds of different levels of filters you can buy. You just need to make sure you're changing them regularly so you're not hurting your furnace. But if you have a very, very good filter, you need to make sure you change it if it gets dirty. Otherwise your furnace is gonna be working harder, the air handler, I believe. So you need to make sure if you buy a really efficient filter, you need to change it according to recommendations.
Okay. And then, I guess kind of to follow a little bit what Dr. Zal was talking about, when companies are not in compliance, or if they go, if they're in non-attainment, for example, what happens then? Is there a possibility of getting shut down, or is it just fines, or do they have to fix things or get fines? Like,
Yeah.
what happens to companies?
So the start of enforcement is a notice of violation, probably like the health department does. And then they are required to submit a compliance plan of how they're going to come into compliance. And depending on what the violation is dependent on if there's penalties or if there's other plans needed or other tests needed. So it's all dependent on what the situation is. The typical routes, there can be anything from a letter up into a court case, that you go to court and fight about. I mean, I've had to testify a couple times on different cases that have gone to court, and then a judge would decide on the case.
What kinds of things can happen, like if the judge decides against the company? Is it just fines? Do they get shut down?
Yeah,
What happens?
the attorneys are usually looking for injunctive relief. So they're looking for the things the company needs to do to address the violations,
Okay.
so.
Very
I always
good.
think, is it true that, sometimes you have those big companies that will
Yeah.
be large, what do you call it, large offenders. But isn't it true that a lot of small companies could equate to
Yeah.
I mean, so I always think that we should look at the overall industrial pieces that we bring in to the community, because sometimes you may not be able to
Yeah.
do anything about the two big ones that you have.
Well-
But you certainly have some control over how many little ones are still emitting.
Yes, and so one of the things that one of the big companies said was, well, what about that company
Mhm,
over there,
mhm.
and that one, and that
Mhm.
one? Because there are a lot of industry surrounding
Right.
them.
Mhm.
So we have also been going and doing inspections at all of those. And I think we had a report of like a gas leak the one weekend that we were investigating,
Mhm.
that was coming from one of the smaller companies.
Mhm.
So, yeah, that's part of it.
And then was there any, for Middletown Coke Company with the 2025 170 complaints versus
Yeah.
prior, years, 21, 23, even only 7 in 2020. Has there been anything found about what the increase was about at this point?
Well, most of the complaints are odors.
For that.
So, for Middletown Code.
Do you think that's just because people have been more informed about how to make the complaints, or what do you think?
I think that is a factor, but I think something is different. And honestly, we are in the middle of investigating that.
Okay.
And doing inspections and talking with Ohio EPA, because we essentially work for Ohio EPA. So as part of our enforcement case, we're looking at what is the difference and what is the cause? So a lot of our investigations and inspections, you know, we'll look at different pieces over time and spend time looking at records to try to see if there's anything different.
When that's found, do you share that with the health department of
If,
Middletown?
yeah, well,
I know
anything we
it's the
do is a
reports.
public record, so you could have copies of all the complaints, you could have copies of inspections, so anything that we do, of course, is a public record, just like
Yeah,
you guys.
Right, and most times she gives Carla and I a heads up if something's going on, she'll send something, or she'll call and say, we were concerned about this, have you guys heard any complaints? So we do
Yeah.
work closely together as you
Yeah,
begin
if you
your
guys hear
investigations
stuff,
and stuff.
continue to let me know, and then
Mhm.
we can put our ears out there. If you see even something on social media, like alert us.
Okay. And I already asked 3 questions, I have more, but does anybody else have any other questions this morning or comments? All right, I'll behave. Thank you very much.
You guys are fun.
She'll be back next year.
I know,
Yeah.
excellent, I'll just keep a tally, thank you.
All right, well, I'm going to respond to a complaint. You guys have my information, so if
Yeah.
you
Thank
guys
you.
think of
Thank
other
you.
questions, or if you want those media, just send me a list of what you want.
I have it,
Yep,
yep.
and I will send it over.
Thank you
Thanks
very
for the
much.
And you
invite,
just let me
thank
know when I
you.
send her this if it's anything else to keep her accessible. Yeah.
Thank you, okay.
Bathroom around the corner? Yes.
All right, well, thank you everyone for that. Next on our agenda this morning is our new business. So we have no travel authorizations to look at. We do need to look at the approval of a personal appointment of Charm Street to environmental health specialist in training. Is there a motion to approve? Is there a motion to approve?
Sure, yes.
So, okay, and is there a second? Okay, it has been properly moved and seconded. Is there any discussion before you vote? You wanna explain this a little bit?
Carla,
please?
I'm just letting you take over, this is yours.
Oh, okay, we're looking for, Charm to start, the 17th, which is next week, and, we're looking forward to having her. She's been working in the field for a couple of years, so she does have a little bit of training behind her, under her belt, so we're excited about that.
Yeah, and she also should be close to being able to apply for her license, her
Oh, good.
registration.
Very good.
So that would be another excellent thing. Right now, she's still a sanitarian in training.
Just curious, is she from Middletown?
She lives in Monroe.
Okay, just curious. People like it when people are from here.
That's close.
That's close. All right. Any further conversation, questions, or comments? Okay, hearing none, we'll proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey?
Yes.
Ms. Baggett?
Yes.
Dr. Zollin?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Mrs. Habit, and the motion passes. And the final item under new business is our 2025 annual report. Okay. Health Commissioner, did you want to speak to the annual report?
Nope, it's just in the packet. Look, I'm trying to keep it,
It's-
I'm trying to keep the meeting
Shorter?
short. It's
Okay, it's usually it's very similar
Yes.
information every year.
Every year.
So does anybody have any comments or questions about the annual report this year?
FYI, this is due by the state. The 15th, we have to submit it every year on January 15th.
All right, hearing none, then that concludes our new business for the day. Next on our agenda are our reports. Health Commissioner, please go ahead.
My information should be in the packet, but just starting up with some last presentations I'll do this year before my retirement. But the Presbyterian Church wanted me to come by and speak about the community health assessment and what their health are what we're seeing in Middletown. And Rotary, New Era Baptist Church will have some type of health panel and a health fair coming up in April, so those kind of things we'll be doing. And we had a great, I just wanted to say this when we get it, you guys save the date on there, but we had a Amanda Septic meeting, and it was a really good meeting. We are coming up on completion of the task of notifying the community of this, that they have septics, what kind of shape they're in, making sure that they know how to maintain them, that they know that they have them, how to maintain them, and also that we have the EPA grant to help them if they're seeing any problems, and so.
And their homeowners.
And their if they're homeowners, yes, if they're homeowners, and for the landlords to know that it's their responsibility too. But we've had the attention of the mayor and the city manager through this whole thing, and really excited that we're getting some kind of process if people need help and if they need to do that. So that meeting is April 30th. You'll get information, 5:30 to 7. We're thinking of doing it maybe on the outside, and just having a community meeting for that area. But that's about it, I think.
All right, well, thank you very much. Next, our medical director.
Good morning, everyone.
Good morning.
Reportable illnesses. We had, for the month of January, we had 23 chlamydia, 7 gonorrhea, 3 hepatitis C, which were chronic hepatitis C, not new infections, 3 pertussis, 3 strep pneumoniae, 1 syphilis, and 1 campylobacter, 1 hepatitis B. And influenza is in here, is obviously on the downswing finally, and but not gone. So, and that's all.
Any questions or comments? And I do have a question, sort of, or just maybe a point of discussion. This thing that's kind of going around where everybody's just sort of congested for weeks, but not sick, not ill. Thoughts? Anything people can do? Anything there?
Well, typically those are viral infections that we really don't have a test for or a diagnosis for.
Yeah.
They're common. I think prevention is the key, because once you get it, there's not a whole lot you can do. I mean, there's some symptom relief things, but washing your hands, cleaning surfaces, trying to avoid contacts, particularly with ill people, are your best things to try not to get it in the first place.
Gotcha. And once you have it, just take care of yourself, basically, as well as you
Yes.
can.
Yep.
Try to stay healthy, get your sleep. That's true, right? You're
Plenty of
talking.
fluids.
Yeah, plenty of fluids, vitamin C, that kind of stuff. All right, yeah, it's a lot right now.
And some of them definitely linger.
Yes.
And sometimes they are contagious. Because when people say it's just viral, I'm like, well, viral.
Just viral.
No, they're all, they're all contagious.
Yeah.
If it's not allergies, it's all contagious.
Right,
So,
yeah.
Is it,
if you didn't have it yesterday and you have it today, it's contagious,
Yeah.
probably contagious.
Yeah.
question about that too, though. I don't know if you know this, but like how long it's contagious for? Cause I just spoke to somebody on the elevator, and they said they'd had congestion for 3 weeks. So are they quote unquote contagious in the beginning, but then not contagious anymore, just dealing with symptoms? Do you know anything about that?
I don't know that I can say an
Yeah.
exact date, but typically, yeah, you're gonna be contagious before you really get symptoms.
Mhm.
And then you're probably gonna be contagious for another, 5, 7, 10 days.
Wow.
Eventually, you'll have inflammation from everything that's gone on, but not be contagious, but still have symptoms. But, exactly when that is, it's gonna be hard to determine based on what virus it is.
Gotcha.
But
So
you're probably
still-
looking at a good, in most cases, you're probably contagious for a good week or so while you're sick.
That's good to know. So distancing, masks, if you wear a mask, if you're around people, that kind of thing might help.
I think again, it's wash your own hands, stay away from people, try not to touch too many things, try not to put your germs in other people's spaces.
All right.
And it's important to know if you start getting worse, you may be getting a secondary infection. So some people think this is just hanging on, but you could have picked up something else, so you may need to seek care. Or seek a doctor's care to get tested, because you could start off that way, and then you can get RSV, you can get COVID, you can
Well, if
get
you get
flu.
sick from her, you'll know she's still contagious.
Well, yeah, that's made me sick time.
3 weeks later.
I don't have any,
Oh, yeah, I'll call you.
yeah.
Bring me some soup. Bring me some soup.
Yeah, well, thank you for saying that, because yes, so many people are talking about it, like,
It's
so.
a strange respiratory season, isn't it?
Yeah.
It's this really, we've had a bad one.
All right, any other questions or comments for our medical director, Dr. Genoway? All right, we'll continue, thank you so much, Doctor. Director of Nursing.
Okay, along the lines too, with the annual report and with what you'll see moving forward too, you'll see a sharp decline in the COVID cases. That's not because it's not there, it's that it's now, as of October of last year, it's only reportable for hospitalizations, much like flu is only reported for hospitalizations. So, not every single case that goes to the hospital, that's tested positive gets reported anymore. It's strictly if you're admitted. So those numbers may look like there's just a sharp decline, and that's why. We are still monitoring a long-term care facility for any potential Legionella cases. Their facility tested negative in their water system, but as a result of the potential of the case acquiring it at a healthcare facility, we are having the facility preemptively, if anybody gets diagnosed with pneumonia, they are automatically tested for Legionella just to rule it out. And then we're gonna do that through the spring to give it a good 6 months from the time that the first case came positive, but so far so good. And there is a potential on the preparedness side. The Health Collaborative, which is a regional partner of ours for preparedness efforts, is asking for approval for funding to send folks, emergency response coordinators, to a conference in April, fully funded. And I expressed interest. They're pending the approval of that budget item, so that may be something that I'll get more information to you guys on next month. I should know more.
Just FYI too, travel that is out of state usually always has to be approved by city manager. It always kind of goes past the city manager. And any travel that we do here at the health department out of state, especially that's not mandated by ADH, is usually 100% paid for by another group that wants people going. They either have grant money that can send you or whatever. So when you guys approve any kind of travel like that, it is always 100% covered. So just know that. But they always look at it, and finance, they'll say, where are you getting the money? And city manager kind of signs off on it, especially if we're going through budgetary.
Where's this
Yeah.
conference at?
Baltimore.
It's April 12th through the 16th, I believe.
Get some crab cakes.
Record should show she mentioned crab cakes.
I know.
Cakes, yeah.
Yeah, bring a freezer bag with you.
I'm kidding, don't put that in there.
Extra
Necessary.
luggage just to bring home the
Yeah.
good stuff.
All right, any other questions or comments for our nurse? Nope, okay, thank you very much, and then our environmental health director.
Okay, good morning. We received one plan review, expedited plan review for the month of January, which was Butler Tech Aviation. They are licensed. It is a school, I think it's 9 through 12?
Yes.
9 through 12?
It's high school, yeah, well, right now it should be just 10 through 12, yeah.
10 through 12. We have 6 new micro markets at Cleveland Cliffs. As I mentioned last month, we're gonna see a reduction in vending, but to replace the vending locations, the micro markets are going in their location. So.
Is that the same cost, Carla?
No, the vending is in it's like $20 or something, and the micro markets are 100, and so the increase, what? Level 1? Yeah, same as level 1, yep. We're in the process of still collecting food renewals and septic renewals for the businesses, and we are trying to finish up our few inspections. The licensing year for food renewals end in February 28th, so we're in the process of finishing that up. Hopefully Charm can help us. I think she'll have a week left. We'll have a week left, so hopefully she can help us finish up, completing those. Brandy did a good job with completing a lot of the inspections before we left, so we don't have a whole lot to finish. And I think that's it
All
for
right,
us.
thank you. Any questions or comments? Talking about Butler Tech Aviation, I was able to go on a tour just yesterday of the new facility. It's absolutely fascinating, beautiful, the students are over the moon, it's so exciting. And there will be a public open house where everybody can tour, and I believe it's on Wednesday, March 18th. I believe that's the date, but I would highly recommend a tour and a visit, and just trying to get the word out to our students here in Middletown, but anywhere actually anywhere. People move to Butler County just to go to some of these Butler Tech schools, especially for aviation. So it's extremely exciting.
Do they go for part of the day, or do they go to school there the whole day, and they
That's a
have
good
regular
question.
classes and then extra? Is that how it works?
I think it depends.
Yeah, I think it may depend, but I think now if you're a Butler Tech student, you get all your education through Butler Tech.
So you go to the classes there and then the extra or whatever
think-
there?
Mhm.
I
But now
think
they
have, like, I got a niece
ins and outs.
there, and they, like, their English and their math, everything is geared towards what they,
Their career choice.
whatever career path
Really?
they're on.
Mhm.
So they still get all the other stuff, but it's
Mhm.
all,
You can go
At Butler
to
Tech.
Butler Tech
Yeah.
and go to college too, right?
Mhm.
Yeah.
They have many, like some of them have certain pathways into higher education. For
Mhm.
example,
Oh, okay.
with the aviation, there are three pathways. So there's like mechanics, like being like a mechanic, but you can also go into piloting, and there's also engineering.
I see.
And especially for that, there's like that pathway into,
Different.
yes, into further higher education as well.
That's pretty
It's really neat, and even like the ideas for expansion, it's very exciting. Highly recommend a visit, for sure.
Yeah. I remember a long time ago, Butler Tech used to be kind of alternative. Now,
Yeah.
nope, it's competitive.
Mhm.
You're lucky if you get in.
yeah.
You are lucky if you get in, and it's so much fun. We all know people, we might even be those people ourselves who have those kinds of brains. Like you take things apart, put them back together, you like to know how things work, and your mind works that way. This is such a great opportunity Butler Tech offers for not just aviation, but everything for students and people who are like that, where school is just kind of boring, like, I need to do something and get in there. I love that.
Yeah.
It makes me so happy, so very excited about that. So thank you for letting me share that. Okay, and did you want to say any updates about the health commissioner search?
No, we have applications coming in until Friday, and, getting good applications, so I think you guys will be.
How many so far?
A zillion, but you want me to say, like,
many
not
have
the
you narrowed
janitor,
down?
not the janitor, Wendy's?
Yeah.
Okay.
Oh, gosh, really?
Yes, they
Yeah.
don't even cipher those out. So we probably have, and Carla can correct me, we probably have about 3 or 4 health commissioners, 2 environmental directors, 1 or 2 nursing directors, and then others with masters in health administration.
Wow.
So remember, we were gonna try to pull out 10?
Yes.
So I think we should be able to have some.
Nice variety.
Yeah,
Yeah, so it sounds like we'll have 10.
I think we will.
Yeah, 'cause I think the last time you told me, like a week or 2 ago, it was like at 18 or
Yeah.
something like
Yeah,
that.
and I think 3 doctors. We can throw them out if we don't like, I'm just kidding. Like, I'm teasing, all doctors are good. You doctors are nice.
Three doctors?
Yeah. One
Wow.
had training in
Tells you how the
Ukraine.
doctor business is,
I
doesn't
said
it?
one had training in Ukraine, so we can, like I said, I'm just teasing, yeah.
That's very interesting to
Very
me.
good.
I'm not kidding. It's a host of, don't they, it's a big, a lot of like, nursing homes, hospitals, administration, yep.
Wow.
All right.
That's
Yep.
exciting.
It is
Yeah,
exciting.
it is.
So next meeting, we'll have the executive session.
Mhm.
Yeah, so next meeting, what is it, March, take a little bit longer. Yes,
March 10th.
March 10th, is it?
Yep, yeah, March
Yep.
10th.
So hopefully we can plan for that.
Mhm.
All right, if there's nothing else, anything else? All right, then we can be adjourned. Thank you so much, everyone. We'll see you in
I'm looking
March.
at this, I think it's so
Amanda.
cute.
Oh, thank
I
you.
really wanna know
Amanda.